Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. In North Carolina, there are currently 5,465 cases of COVID-19 in 94 counties. There have been 131 fatalities in North Carolina associated with COVID-19. Currently, the state is reporting 452 hospitalizations across the state from COVID-19 illness. To date, Dare County has reported 15 positive test results for COVID-19. Of the 15 individuals who have tested positive, 13 have recovered or are asymptomatically cleared, meaning they are 7 days post-testing with no symptoms. One is asymptomatic, meaning they have not experienced any COVID-19 symptoms, and one died. While the number of positive test results has remained stable over the past several days, this does not mean that COVID-19 is not in our community. Remember, the CDC reports that approximately 25% of patients with COVID-19 do not show symptoms. We all must continue to do our part to keep our community healthy. With the economic hardships created by the COVID-19 crisis, many in the community are anxious for a timeline to establish expanded entry to the county. Dare County's Stay Home, Stay Healthy order aligns with the governor's stay-at-home order and is effective through April 29th. The Dare County Control Group meets frequently for updates regarding COVID-19 and to address all related issues and concerns. As April 29th approaches, the Control Group will continue to have serious discussions about ways to most effectively balance the health of our community and the economic impacts in order to make decisions that are in the best interest of all. Local officials have begun those discussions regarding the timeline for entry to Dare County. When implemented, it is likely that a staged entry process will be implemented to allow non-resident property owners entry before allowing entry to visitors. As decisions on entry are made, consideration is being given to the governor's actions regarding the state's stay-at-home order, the scientific data including trends and models that are frequently changing, the capacity of local health care providers, and the ability of local merchants to provide essential goods and services. Yesterday, I shared information on how public health works in our community regarding community awareness and education and how that's helping reduce the spread of COVID-19. Today, I want to touch on another important health tool that is effective in reducing the spread of communicable diseases like COVID-19, and that is contact tracing. Contact tracing, also called contact investigation, is a common public health practice in which we interview a person with a disease. We ask them about places they have been and who they may have been in contact with. Our public health team is very familiar with contact investigations because we do them frequently for diseases like HIV, tuberculosis, and chlamydia. For COVID-19, contact monitoring is very similar. It starts with us interviewing a person with a positive test for COVID-19. We ask them about places they have been, and we ask them to list people who they may have had close contact with. The CDC considers a close contact as someone who is within about 6 feet of someone with COVID-19 for 10 minutes or greater, or had direct contact with infectious secretions of a person with COVID-19, like when they are coughed on. Once we have this information, we put on our disease detective hats. We gather contact information for all the people who may have had close contact with a person who has COVID-19. For example, if a person told us they went to a party at a friend's house, we would contact the friend and get a list of every person who attended the party. We would follow up with each of these people. Hollywood often depicts this contact investigation process as complicated. Think of bulletin boards with hundreds of strings coming off a central patient. While following up with contacts is time-intensive, it's rather straightforward for us. Remember, we do this often for certain communicable diseases. One of the hardest parts of a contact investigation is getting people to answer their phones. Given HIPAA privacy concerns, we can't leave specific information on a person's voicemail or answering machine. In most contact investigations, we reach people by phone. If necessary, we will follow up by email, text, and letter multiple times until we get a response from a contact. Once we connect with these contacts, we let them know that they may have been exposed to COVID-19. We tell them about what symptoms to look for. If they meet certain criteria, for example, they rode in a taxi with a person who has coronavirus, We make sure they isolate themselves. In all of our contact investigation and monitoring experience, the vast majority of people follow isolation instructions because they want to do the right thing and protect others from getting sick. If a contact does not want to follow isolation instructions, state laws give us the legal authority to mandate isolation. Keep in mind that isolated people may not necessarily be sick. We follow up with contacts daily to see if they have symptoms and make sure they are isolating as appropriate. We have been conducting contact tracing since our very first positive test result back on March 25th of 2020, and contact tracing will be a vital tool for us as we progress through this pandemic. As we move forward through this pandemic together, facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we receive it, and we encourage you to stay informed by visiting www.darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center at 252-475-5008. Thank you.